Hi, so Dr. Derek, and today I'd like to talk to you about sacroiliac pain. The sacroiliac joint consists of two bones, the sacrum and the ilium. Thus you get sacroiliac. It's a joint right here where these two bones meet. If you put your hands on top of your hips, you'll feel a little bone protruding. That's what you're feeling right here. Right underneath that is a sacroiliac joint. So if you have pain right in there, you could have a sacroiliac subluxation. So this bone will subluxate in one of four ways or a combination. It'll either go anterior superior, posterior inferior, it'll internally rotate or externally rotate, or a combination of the two. But when you have pain in this area, you will know it. It's typically caused by trauma, like lifting weights wrong, or a jarring accident, or a football injury. That will typically cause this joint to subluxate. It can also subluxate just from your daily activities of living that you're doing on a chronic, repetitive level, like always sitting, constantly gardening, or doing some type of activity where you're up and down and stressing this joint. And so if this joint goes out of alignment, you need to get this adjusted, and you need to adjust this specifically. A specific adjustment to this joint makes all the difference in the world. So if this joint has gone posterior inferior, I'm going to want to adjust it anterior superior to put it back in its place. That's the key to this, correcting this type of problem, is this specific adjustment. And then the muscle that you want to address on this is your psoas muscle. And so one of the things that I like to do, if you're going to do a tennis ball, it's hard to get that psoas, but you can get it where it inserts here onto the femur. So I just get the ball right here. Well, it's hard to show, but you're going to lay on it right here when you're laying on the floor. So this is a good spot. Do the ball first for like 10 seconds, let it dig in there, and then follow it up with this stretch, just like this. You can do this on the bed or on a couch. And while you're doing this, the key is just to rotate that hip a little bit more right in through there to get that real good stretch on that psoas muscle. One thing that we like to do after you adjust, along with that, is doing the energy pressure wave technology. This will help regenerate damaged tissue, and it helps break up scar tissue. So we just like to put that right here in the joint itself and break that up all around through there. Your joint feels like a new joint. It feels amazing, and the pain is relieved immediately. At the end of this video, you'll see a gentleman who's a colleague of mine. Befriended this guy. We became pretty good friends. He's a great guy. He's a very successful practice in Newport Beach. He injured his sacroiliac joint lifting weights, and he'll share his story with you at the end. But if you get these joints in properly, you can make a huge difference. Now, if you want to prevent this from happening in the first place, one of the keys is wearing the right shoe, a good shoe with good support. Make sure your shoes aren't too tight. Make sure they have good cushion and are absorbing the shock, because this absorbs a lot of the shock when you're walking. And if your shoes aren't giving you good support, instead of your shoes absorbing, your sacroiliac joint will absorb the shock when you're walking. So make sure you have good shoes. I also highly recommend that you wear a good pair of orthotics to take the pressure off of this joint as well. I hope this video has been helpful. This is Dr. Derek signing off.
My name is Dr. Phillip Yoo. I'm the director of the 21st Century Pain Institute in Newport Beach, California. Anyways, my story was like an idiot. I deadlifted 455 pounds without a belt. I got it up, but the next day my back was on fire, probably a 10 out of pain. My right SI joint felt like there was a knife in there. And I met Dr. Derek Taylor at this conference, and he worked on me and did some muscle energy work and adjusted me, and my pain went for a 10 to 1 in one treatment. So this guy's very skilled, and just me being in an industry, there's not a lot of guys who can really treat and adjust like him. So if you're in pain, you'd be a fool not to have Dr. Derek get his hands on you. So